African countries have been urged to enhance surveillance as COVID-19 cases increase in other countries. Health authorities around the world are now mulling the transition of the pandemic to an endemic state. Irrespective of COVID-19 status, the Africa CDC wants AU member states to increase vaccination efforts. CGTN's Enoch tells us more.
Like every corner of the world, the African continent found itself in the midst of a global health emergency 3 years ago. Almost 3 years after COVID-19 was first detected in Africa, a total of over 12 million cases and over 250,000 deaths have been reported by 55 member states of the African Union. The Africa CDC says this represents 2% of cases and 4% of all deaths reported globally. At the beginning of the pandemic, health systems in Africa were inadequately prepared to handle the viral infection and its impact. Equipped hospitals were few and wide, and response by many countries became strained. According to the World Bank, while sub-Saharan Africa appears to have avoided a catastrophic health scenario and life is taking on a sense of normalcy, the region continues to face scaring effects of the pandemic. The World Health Organization says the number of weekly infections has been rising since December.
In total, in the past 8 weeks, more than 170,000 people have died of COVID-19. That's just reported deaths. The actual number of deaths is much higher.
According to the Africa CDC, African countries have improved their health systems and are better prepared to handle pandemics than they were before COVID-19. In most countries, new facilities have been built, while diagnostic and surveillance capabilities have been improved. WHO and Africa CDC are urging countries to utilize these facilities effectively with the rising number of infections in several countries across the globe.
While we're clearly in better shape than 3 years ago when this pandemic first hit, the global collective response is once again under strain.
I think the message is crystal clear in terms of the effectiveness of vaccination, in particular against severe disease. Now, however, one thing which I think people need to be clear is when the vaccines are not perfect, and if vaccination coverage is very high, you will see an increasing proportion of the severe cases also in the people who have been vaccinated. This is simple arithmetics.
Of more concern to the Africa CDC is the potential for the Omicron subvariant BF7 to be more transmissible and more evasive to immunity acquired from vaccination and or prior COVID-19 infection. But experts maintain that vaccination remains to be the best weapon. Enoch CGTN, Nairobi, Kenya.